I am Ilona Velarde and today I'm interviewing Dr. David Dighton, a London and Nicosia-based cardiologist. Welcome, David. Today I would like to ask you about breathlessness. Lots of people have breathlessness. Are there many different causes?
Well, the commonest causes are being overweight and being unfit. And if we believe the World Health Organization data, then a very large number of people are now overweight and unfit. As doctors, though, of course, our main concern is as well is, does the patient have lung disease or do they have heart disease?
Does age have a lot to do with the causes found?
Yes, I mean, young people are either overweight or they may have asthma. They don't usually have many other causes. In older people, it gets very complicated because, for instance, in smokers, they might have lung disease, they might have inherited lung disease. There's all sorts of complicated lung diseases, but older people have asthma as well. But there's a type of asthma which we call cardiac asthma, which is related to heart failure. So we're looking for people who are breathless because their heart is weak. That's a very important issue in older people. And we're looking for coronary artery disease. As the arteries narrow in the heart, one of the very first symptoms is that the patient notices breathlessness. And that's a very important early indication of coronary artery disease, but it takes a lot of testing to find out whether that's the case, of course.
What heart conditions cause breathlessness?
Well, perhaps the commonest one these days, there are two: heart failure, which is where the heart is actually weak, and coronary artery disease. They're the ones that we're mainly looking for at the moment.
David, could you please explain us why does heart disease cause breathlessness?
Well, to make it simple, the heart may just be weak. It just can't pump well enough to supply the body with oxygen, so patients run out of oxygen. The other reason is, an engineer would understand this, that an engine in a car would have fuel starvation. That is, not enough petrol gets through to the engine and so it won't work properly. In terms of the heart, the coronary arteries, which supply blood to the heart itself, get blocked. Not enough oxygen gets to the heart, and that causes breathlessness. So those are the main causes: artery narrowing and heart weakness.
Does breathlessness occur early or late in a coronary heart disease?
Well, both. But the one that concerns me most is the early one, because it gives us an early sign which enables us to investigate people and cure them before it gets too bad. There are people with very bad coronary artery disease who've already had many interventions who are breathless where the heart has become weak. So the most important thing is the early form, because it gives us a chance to treat them early and get them better before it deteriorates.
So are there any other early symptoms?
Well, with coronary artery disease, most people think that it causes chest pain. It actually causes chest tightness rather than chest pain. But interestingly, if you take 100 people with coronary artery disease, the earliest symptoms in about 90% of them is breathlessness. That's the earliest. Later on, they get chest tightness. And in fact, we think probably only 1 in 20 people get chest pain and chest tightness, whereas about 90% or even more get breathlessness.
Is there a specific sign of heart...
Start again.
Again, we do it again. Is there a specific sign of weak heart, wheezing for instance?
Yes, I think breathlessness is one of the very early signs of it, and they can wheeze, especially at night, something we call cardiac asthma. And then, of course, there are other signs of heart weakness as well, like swollen feet. But swollen feet occurs mainly in people that are sitting around a long time. So breathlessness is the most specific of them. There is another symptom I'd like to mention, which is, we in English call it running out of steam. That's a person that's walking along who feels they can no longer carry on. Their energy disappears. They're usually slightly breathless at the time, but they just don't have the energy to carry on. That's a terribly important symptom early on in heart weakness and in coronary disease as well.
I would be right to say that such a patient should seek urgent attention?
Well, of course, many people will be just unfit and overweight, so we don't want to create anxiety for them. But there are many people who need investigating, who should be seen, and it's really for the general practitioner, I think the general doctor, to find out whether they think it's heart disease, and if it is heart disease, that needs to be confirmed with the various tests we use, like heart tracings, echo soundings of the heart, and so on. So yes, I think for an older person who's getting a bit more breathless and feels it's abnormal, I think it is fairly urgent to be tested, yeah.
How do you tell the difference between asthma and heart disease as a cause of breathlessness?
Well, most people with asthma have had it since they're quite young, and they have a history of allergy or infection, chest infections, and it's fairly obvious when they are suffering with what we call bronchial asthma. If you have a person of 50 or 60 who has never had wheezing before and suddenly develops it, it can be allergic, it can be due to a chest infection, but the question in every physician's mind would be, is this the heart causing asthma?
Many people are unfit and overweight. Should they be worried?
Well, overweight and unfit people do get heart disease, of course, but I think the difference here is that if it's been there for a long time, the weight and the breathlessness due to unfitness, and doesn't change, that's probably the best guide to the fact that it's innocent. It's the rapid onset of breathlessness that we're worried. So whether you're thin or whether you're overweight, whether you're fit or unfit, if you start to get much more breathless doing the same thing every day, then that's the clue that it might be heart disease. It may be a struggle to walk, but if it becomes a great struggle to walk, then you should seek advice and ask the question, is my heart okay?
I guess that increasing breathlessness is much more serious in older people.
Yes, I think that's right. I think that if an older person develops breathlessness over the course of a few weeks or months, that is a fairly serious sign. People with lung disease who are old and breathless have probably had it for years, so there's not much change there. So that's unlikely to be their heart.
But does heart failure run in families?
It's a very good question. I don't think it does as such. Coronary artery disease does. If you have one parent with a heart attack or with angina, then 1 in 4 of their children will have that. And of course, coronary disease can lead to heart failure. So to that extent, it runs in families, but it doesn't obviously so.
Can patients contact you?
Yes, they can through our various websites. We have 2, one in Cyprus, which is www.heartsense.com.cy, and in England, the Cardiac Centre UK.co.uk. But I've left the details on a caption after this interview if anyone wants to contact me.
All that remains is to thank you for watching and Dr. David Dighton coming to help us understand about the breathlessness.
Thank you for asking me.
This is Ilona Velarde saying goodbye for now, and please note our other videos explain about other heart symptoms. If you would like to have more information about this subject, why not buy or download our Heart Sense book, which is easy to read and contains useful information about the heart and the best diet to eat. In case you would like to read something more technical, you can buy our Eat to Your Heart content book from our websites. And you can also download this very short brochure, Worried About Your Heart, which explains many details about heart problems and which is available in 4 languages: English, Greek, German and Russian. Don't forget to purchase our Heart Sense supplement, which is essential to even the best diet. Soon we will also have Heart Sense tablets, which will be available on our websites. All our products and information are available on our websites, heartsense.com.cy and the Cardiac Centre UK.co.uk.